Welcome to Hey Dr. Sue. So people submit their sex questions to me anonymously, and once a week I post one question and one answer. Do you have a sex question you've always wanted answered? Go ahead and check out the description for information on how to submit it anonymously. This week's question is ass to mouth safe? So it kind of depends on how you define safe. When we talk about sex play and risk in this country, we usually focus on two things: pregnancy and STIs. Ass to mouth, or rimming, or analingus, if we want to get more technical, has no risk of pregnancy. There is, however, a risk of contracting not only an STI, but other diseases as well. Bacterial STIs like gonorrhea, chlamydia, and syphilis can all be transmitted through rimming. So can viral infections like herpes and HPV. But sexually transmitted infections aren't the only things you need to think about when it comes to rimming. There's also the risk of contracting some bacterial infections and also some parasitic infections. The good news is that there are things you can do to cut down on the risk of STI transmission from ass to mouth. You know how you always hear that you should use a condom to prevent getting an STI? Same concept here, but we need to do it a little bit differently. The reason we tell people to use condoms is because it's a barrier that can stop the transmission of things like bacteria and viruses. But it's a little more complicated than just pulling out a condom out of the package and being ready to go in this case. That's because in this situation, there's nothing to unroll it onto, like there's no penis or sex toy. So you need to cut it open into like a 6x6 square and lay it flat and then put it between the mouth and the anus. You could use a dental dam, but honestly, most people don't have easy access to those. If you're interested in them, you can definitely buy them online. If you're going to use a barrier for ass to mouth, do an allergy check first, please. If you're using a latex dental dam or condom, make sure no one involved is allergic to latex. If anyone is allergic, you can use condoms or dental dams that are not made from latex. Two last things to think about. 1, cleanliness, and 2, general gut health. So for cleanliness, clean the area before ass to mouth. For general gut health, if the person whose ass is being licked has had runny diarrhea or an upset stomach, you may just want to wait until that's been resolved. If you're engaging in ass to mouth, regardless of which end of it you're on, I do suggest getting STI tested. Until next time, be safe and have fun. Did you like that video? If so, make sure to like and subscribe to the channel. That way you'll know when new videos come out. Also, check out the description to find out how to find me on Instagram, Medium, and Threads. And make sure to check the description for links where you can submit your own sex question.